So, good day, everyone. We are the presenter of the lung abscess, and I am Julia FORTUNO from Section C, together with my partner.
Rashid QUIñONES from Section E.
We will be talking about the lung abscess. So, first, let's define the lung abscess. The definition of the lung abscess is it is a localized collection of pus caused by microbial infection. It is generally caused by aspiration of anaerobic bacteria in a lung abscess. It is usually occurring in the posterior segment of upper lobe. With it is the most common site of the lung abscess. And next, an aerobic organism that is most frequently associated with the lung abscess is the Staphylococcus aureus. For the pathophysiology, so the first is the predisposing factors, which are the loss of glottal closure or swallowing difficulties. The others, such as altered state of consciousness, those on a post-OP patient are mostly these. And next is the esophageal disease. And lastly are the patients that are fed by nasogastric tube. The precipitating factors are or the microbial infection. So let's come to the first part of the lung abscess. Lung abscess is caused by primary and secondary factors. So the primary will be the aspiration of foreign materials or gastrointestinal contents, and the secondary factors that contribute to lung abscess um, is the secondary factor, which are the what we call the occurring diseases such as pneumonia and bronchial obstruction. So let's go for the primary cause of the lung abscess, the aspiration of gastrointestinal contents or the foreign materials. As the aspiration of the foreign materials, it will go to the lungs, and it will be introduced to the lung tissues. As the accumulation, as the foreign materials enter the lungs, it will introduce and accumulate to the lung tissue. As it accumulates, it causes to uh, create an immune response activation, which leads to fever. The signs and symptoms of fever. Next would be during this immune response, alveolar macrophages activates, which fights the microbes or the foreign materials that enters the lungs. If the alveolar macrophages able to fight the microorganism, it will contain the infection. But if the macrophages was not able to clear the microorganism, the neutrophil will respond. Also, the antimicrobial peptides and surfactants proteins. So the microorganism was suppressed by this level. The infection may be contained. But if the the microorganism was not cleared by this level or the neutrophil response, then it will lead to tissue necrosis. This tissue necrosis is the what we call um, death of the tissue. It is irreversible. So meaning na namatay na ang mga mm, tissues inside the lungs. When the tissue necrosis occur, cavitation will follow. Di ba naging hollow, since namatay na ang mga cells or the tissue, it will cause to create a hollow space. During this stage, it will lead to, and the necrotic tissues liquefies. As the necrotic tissues liquefies, it fills the cavitation. Then it forms a lung abscess. Let's proceed to the secondary cause of the lung abscess, which are the occurring diseases such as pneumonia. So pneumonia is a occurring disease. This disease is usually caused by the Staphylococcus aureus or Klebsiella pneumoniae. As it enters the lungs, it will cause infection. Then the immune response will occur, since during the immune response against this such microorganism, it will cause a byproduct. Although it fights the immune response, fight the Staphylococcus aureus, during this immune response, it will cause a byproduct that causes lung tissue destruction. Then this lung tissue destruction also causes or proceed to necrosis as well as cavitation, and this cavitation will be filled by the necrotic tissues, then forms a lung abscess. Then the second disease that can occur a lung abscess is a bronchial obstruction. This bronchial obstruction is caused by an obstructed bronchus caused by a tumor. And when an obstructed bronchus is when a bronchus is obstructed, it will cause accumulation of bacteria on that obstructed area. As the accumulation of bacteria occurs, there is a possibility of atelectasis or lung collapse. As the area collapses, it will cause more accumulation of bacteria and further necrosis, as well as cavitation, and this cavitation will be filled with necrotic tissues and lead to lung abscess. So the lung abscess are when the lung abscess is formed, the signs and symptoms are usually fever, mild productive, purulent, foul-smelling sputum, meaning that this purulent, foul-smelling sputum are the necrotic tissues usually. And when the lung abscess is diagnosed, usually the diagnosis would be, or when the lung abscess is diagnosed, the findings would be during a physical exam is dullness and percussion. The lung tissue is filled by the necrotic tissues. Also, the grating or creaking sound during an auscultation. And also, in an X-ray, it reveals that it is infiltrated with air fluid level. It presents na like a hollow part is filled by necrotic tissues like air on top and water at the bottom, or like fluid. Next would be, if a lung abscess is not treated, it will continue to grow. First is there will be a bacterial proliferation. Since it is not treated, it will cause the bacteria to increase. As the bacteria increases, the immune response overload. So nag-a-attack ang immune response, but since masyado nadamo ang bacteria, it will lead to progressive necrosis because during immune response is, di ba may byproduct? Then this byproduct causes um, progressive necrosis or continuous dying of the um, body tissue. So this progressive necrosis will lead to erosion of the lung tissue. And this erosion of lung tissue, as it continues, it may rupture the abscess to the pleural space. Since nag-occupy na ang lung abscess or ingkakao na niya ang lungs, then it may cause thinning of the pleural, what we call the lung space or the lungs, and it may rupture the abscess to the pleural space. As it ruptures, the collection of pus in the pleural space may occur, and this will be called thoracic empyema. Also, when a rupture of abscess happens to the pleural space, this may cause air leakage and pneumothorax, or the presence of air in the lung, or the presence of the air in the pleural space that may cause a partial or complete lung collapse. Then again, if the progressive necrosis is not out, and again, when there is a progressive necrosis, this may also lead to excessive inflammation or enlargement of the lung abscess, since damo na accumulate ng bacteria or necrotic tissue, then it will cause the abscess to inflame, magdako siya. Next, upon or when the enlargement of abscess occurs, this will lead to bacteria that will erode the blood vessels, meaning that the bacteria inside the lung abscess may erode to the blood vessels near the abscess. Then this will cause septic emboli, or the presence of a object or particle in the bloodstream that will cause pyemia, or the circulation of this foreign or infective object in the bloodstream. Septic emboli is presence, while pyemia is nag-circulate na siya throughout the body. Then this will cause multiple abscess and sepsis. And this enlargement of abscess may cause rupture of pulmonary vessels and can lead to internal hemorrhage, and this internal hemorrhage may cause severe hemoptysis. These four are the complication of the what we call lung abscess. So again, we have the tools to sum up. We have the two causes of lung abscess, the primary and the secondary, the aspiration and the occurring diseases. And this aspiration and occurring diseases may form a lung abscess, and if a lung abscess is not treated, it may cause further complications such as thoracic empyema, pneumothorax, and internal hemorrhage and pyemia. As if this is not further treated, it may cause even death. Next would be the medical management.
So before we proceed to the medical management, I would like to just share some information about the prevalence, since we didn't put the prevalence in our report, because the incidence of lung abscess acquired in the community is unknown according to the National Institute of Health. So this lung abscess uh, is likely to occur in elderly men patients, since they have an increased incidence of periodontal disease. And patients who have difficulty swallowing, since lung abscess is caused by aspiration of uh, bacteria or microorganisms, patients who have difficulty swallowing or has impaired cough reflex, and people who cannot close the glottis are at risk for aspiration of uh, foreign bodies. Uh, these incidence or prevalence, uh, most lung abscess are a complication of bacterial pneumonia or are caused by aspiration of, it is said earlier, the oral anaerobe into lungs. So for the medical management, first we have the drainage of the lung abscess through the through postural drainage and chest physiotherapy. So postural drainage is one example of chest physiotherapy, and the others include uh, the other in the others include chest percussion and then uh, vibration. So postural drainage is done depending on the location of the lung abscess. So there are different proper postures that is done to drain the lung abscess. And also the vibration is the shaking or the pressure is applied to the chest wall during exhalation. So this technique is thought to increase the velocity and turbulence of exhaled air. And the chest percussion involves striking the chest wall over the area being drained. So the chest percussion could also be a way of evaluating the severity of the lung abscess. Next is the diet high in protein and calories is necessary to facilitate healing. Since there is a necrosis, no, or the damage of the tissues, the demand of protein and calories increases because healing is occurring or to facilitate healing. And also we have IV antimicrobial therapy and the pharmacologic management such as clindamycin, ampicillin sulbactam, or carbapenems. So, the administration of these antibiotics of the nurses, before administration, one of the nursing responsibilities are to review the dose and the timing of schedule for accuracy, and also check for any allergies for for the uh, to the client, inform the client to report any side effects that might indicate a change of dosage or a change of the prescription. And nurses are also responsible in evaluating the effectiveness of the uh, medical management. So we should also inform the patient or the family member if the case has worsened to immediately report to the primary care provider. So next, for the surgical intervention, surgical intervention is rare. In cases of massive hemoptysis or the vomiting of blood or no response to medical treatment, lobectomy is performed, and this lobectomy is a removal of a lobe in the lungs. For the treatment algorithm, first is uh, assessment of clinical severity and organisms involved. So for the assessment, here we have physical examination and sputum culture and sensitivity and chest x-ray. So the physical examination and the chest x-ray will will diagnose the lung abscess. If the chest x-ray reveals or demonstrate a cavity of at least 2 centimeter, So lung abscess is diagnosed. For the physical examination, we have chest percussion, which will determine the severity of the lung abscess, and it will reveal dullness as mentioned earlier. And for auscultation, we have decreased or absent breath sounds with an intermittent pleural friction rub, or grating, creaking sounds and crackles may be present. And also for the sputum culture and sensitivity, this will determine the specific microorganisms which will be which uh, the pharmacological management depends on the sputum culture and sensitivity. So number 2 is IV antimicrobial therapy, and it may continue for 3 weeks or longer. So as I've said earlier, sputum culture and sensitivity will indicate the drug of choice. It's either clindamycin, ampicillin sulbactam, or carbapenem, depending on the result of the assessment. So next is evaluation of the effectiveness of treatment. After the administration, of course, the evaluation of the effectiveness of treatment, if there is no improvement, the antimicrobial therapy given in intravenous will continue. But if uh, the evaluation reveals normal temperature and decreased white blood cell count, and also improved chest x-ray, the IV therapy will be discontinued and oral antibiotic therapy is initiated for additional 4 to 12 weeks. If treatment is stopped too soon, a relapse may occur. So, it is our responsibility as nurses to educate the patient about the uh, proper administration or the proper dosage of the uh, prescribed by the uh, primary provider. So next, we have nursing intervention. For the nursing interventions, first is administer antibiotic and intravenous therapy as prescribed and monitor for any adverse effect. And also initiate chest physiotherapy as prescribed to drain therapy, and also teach patient about deep breathing and coughing exercises, and encourage diet high in protein and calories. And lastly, uh, provide emotional support since abscess may take a long time to resolve. For the prognosis, with proper antibiotic treatment, prognosis is favorable as high as 80 to 85% unless there is a debilitating underlying condition. So for the prevention, appropriate antibiotic therapy before any dental procedure, and then adequate dental and oral hygiene so that kung mag-aspirate man ang patient sa kanra uh, foreign objects, at least less ang bacteria na kanra ma-aspirate and manlilesen ang risk san lung abscess. And of course, appropriate antimicrobial therapy for patients with pneumonia. So that would be all for the lung abscess. Thank you po.